I'm Amy Gamboa, and I'm going to go ahead and be showing you how to use our Carpu jet with some drugs. So starting off, I went ahead and gathered my supplies. So what you're going to want to do is obviously get your drug that you need. You're going to also compare it to the drug order. So I'm going to use this as my med sheet. And then you're going to need your applicator. And when you're going in with the patient, you're going to also need a flush because you're going to want to check the IV patency before giving any drug out to the patient, and alcohol swabs. So starting off, you come in, assess the patient's IV site, making sure it's not inflamed, any redness, warmth, anything tender to the touch. Go ahead and check and make sure you unclamp the tubing so there's no discrepancy there. Go ahead and open up your alcohol swab. Go ahead and clean that for about 15 seconds. Try not letting anything touch that once you've cleansed that. Make sure you're seeing blood return, and I do, so that's good. So I'm going to go ahead and set that down. I'll have to go ahead and wipe it again because I'm going to go ahead and set up my drug. So go ahead and grab your applicator. So right now showing it shows closed. You're going to want to go ahead and twist the blue top to unloosen it. And then with these, when you take these out of the Pyxis, you're going to do your first check there, and then you're going to do your second check while you're preparing it, and then your third check will be at the bedside with your patient. For these, you're going to want to go ahead and puncture it first so that you don't have issues with that, but this one should already be good. Try not to let anything touch that. And then twist this bottom end to make sure it's tightly in, making sure that your outside numbers is facing you so you can see. And then with my order, I have an order for hydromorphine 0.4 milligrams. Since this is a high-risk drug, you're going to want to have verification with another RN. With it being 0.4 milligrams, I've already done the math and I realized that we're going to give 0.8 milliliters to the patient. So you're going to want to go ahead and waste a couple of it and then go ahead and verify that. So I need 0.8. And I'm at 0.8 now. So you would go ahead and take this to the patient's side. I'm going to put this down for right now. You're going to go ahead and clean this again. Then attach your drug to the IV side of the patient. And with hydromorphone, which is also known as dilaudid, you're going to want to give it over 3 to 5 minutes, since it tends to, you don't want to give it too fast because it'll give a jolt to the patient. So make sure you're doing it slowly. But you have to take into consideration that the drug in the tubing might not actually reach the patient yet. So once it reaches the patient is when you'll start your 3 to 5 minutes. You want to do it slowly and also look at the patient at the same time to making sure they're not grimacing or they're not getting it too fast. So that was over 3 to 5 minutes. Go ahead and just unclamp that, and then make sure that you check your patient 15-30 minutes after to make sure you're assessing for pain afterwards, okay? And that's pretty much it for our Carpu jet injection. Thank you.